What if you were told that you only had 1 month left to live? Now, I'm sure you're thinking of all the places you would go, the people you'd spend time with, and maybe even the things that you would finally check off your bucket list. However, this question reflects so many people's reality. These bucket list items and these last minute plans that you would think of doing aren't how many people get to go. With terminal illnesses, some people are in too much pain to do all this traveling, and some people are at enough peace with where they're currently at to value their quality over the quantity and rather not wait for their life clock to run out. These people want control over their lives, and now they want control over their deaths as well. I will be discussing the benefits of legalizing physician-assisted death in all 50 states instead of just the 10 states that it's currently legal in. These benefits include the fact that it is safe medical practice, which is much different from euthanasia, the fact that it allows for respect and allows for patient autonomy, and it allows for the relief of suffering, and it allows so many people to receive all of these benefits. I think it's important to understand what goes on leading up to a physician-assisted death and the amount of thought that really goes into the process. In the states where physician-assisted death is legal, there are many standard protocols that must be followed. These criteria include the patient must be at least 18 years or older, they must be ruled mentally competent by a licensed psychiatrist, a physician, actually 2 physicians, not just one, has to sign off on their diagnosis and their prognosis. Their prognosis has to be at least 6 or less months to live, and they must be ruled physically and mentally competent to receive this decision, as this is reported by deathwithdignity.com authors. They also state that there's 2 waiting periods that must be fulfilled. The first waiting period is after the oral request for the Death with Dignity law. And the second waiting period is between filling and receiving and taking the prescription. And usually these waiting periods are about 15 to 20 days apart. These safeguards are in place to protect the patients and prevent misuse of this truly beneficial law. Now, something that easily gets confused with physician-assisted dying is something called euthanasia, which is very commonly used in place of, putting animals down. According to a journal titled Physician-Assisted Suicide and Euthanasia in the Intensive Care Unit, a dialogue on core ethical issues written by Dr. Gallagher, Dr. Eli, Dr. Sulmasi, Dr. Baker, and more, discusses the fact that physician-assisted death is the prescription written by a physician of a lethal medication that will end the patient's life that the physician gives to the patient to take on their own time, while euthanasia is the direct causation of a death by a medication directly given to the patient from a physician. Now that you understand all of the legalities that take place behind the scenes of a physician-assisted death, I'd like to discuss how this option can largely impact so many terminally ill patients. Autonomy is an ethical discipline that allows for control over your own personal decisions and actions. This freedom from external control can be applied into everyday life situations, such as which grocery store you want to go to, which types of food you want to buy, and in the name of this speech, physician-assisted death. If patients are allowed control over which medical treatments they choose, or even the rejection of all medical treatments, what is stopping us from allowing them to make their own decisions about their death if they can decide so much about how they live? According to Anna Dykes, a writer for Nursing Master's paper at Winona State University, physician-assisted suicide contributes to a better quality of death and upholds patient autonomy by allowing the patient to die on their own terms, deciding who is present, where and when their death will take place, and ultimately ending the process of painful and undignified lingering. Allowing for autonomy is important because this is something we ideally want in all aspects of our life. So I'd like you to keep that in mind when we talk about our next topic. A patient who is in the end stages of their life may be suffering physically, mentally, emotionally, or all 3. As it's put so well by Dr. Gallagher, Dr. Eli, Dr. Sulmasi, Dr. Baker, and more, We can see no adequate reason why the patient should not be allowed to die at their time of their own choosing, rather than be obliged to wait for unpredictable terminal events with the possibility of suffering despite adequate or maximal palliative care. Instead, why not allow them to choose relief instead of waiting out and staying in so much pain until they eventually die? According to Dr. Braddock and Dr. Tonelli on Physician Aid in Dying, if we serve justice to all of our patients and treat all of our patients equally, why do we allow patients to deny prolonging life treatments if we don't allow them to hasten their inevitable death when they are ready to go, with dignity and on their own terms? Now that you've heard what an impact this law could make on so many people's lives, here's what I would like for you to consider. As Richard Branson puts it so well, an assisted dying law would not result in more people dying, but in fewer people suffering. Physician-assisted dying allows for those who once had control over their life to have control over their death, hence the name Death with Dignity. This topic is very widely debated, and although this choice may not be something that you decide for yourself personally, I highly encourage you to take yourself out of the equation and think about those who are currently in this position. A terminally ill patient with a confirmed prognosis of less than 6 months to live. Although you may take the personal decision to live the rest of your time out, which is totally your choice to do, why don't we give these patients their choice to end their lives with dignity and at the time of their choosing with who they want? These people in those last weeks or last months may see it as watching their life clock tick away, and they don't just want to wither away. Or some people are in too much pain, or some people are truly ready to go and they're at peace with going at this time. These people should have the right to make that decision for themselves, as you can make the decision not to for yourself. Thank you.